and others participating remotely. The meeting is being recorded and published online after the meeting. Could all attendees leave their camera on, but switch off their microphone when not speaking, but switch on both camera and microphone when you are invited to speak, so that this is picked up on the recording. If you wish to speak, please use that raise your hand function or indicate in the meeting chat, and I will alert the chair. Excuse me. I will now do a roll call and would ask that members confirm their attendance when their name is called, so that this is clear in the recording and can also be recorded in the minute. Chair.
Present.
Professor Batty.
Hi, present.
Professor Batty, good morning. I can see you on Teams.
Hi, I hope you can hear me now.
Can people on Teams
Is my
hear me?
microphone not working?
Yeah, okay, thank you. Councillor Bunsell.
Present.
June Brown.
Present.
Councillor Allard.
Yes, present. I won't be here only for the first part.
And Councillor Gregg.
Present.
Jim Curry. See Jim there. Jamie Donaldson. Jenny Gibb.
Yes, I'm here. Good morning.
Thank you, Jenny. I can see you. Can't really hear very well, but thank you. Christine Hemming or Stephen Close?
Yes, I'm here.
Christine. There, thank you. Maggie Hepburn.
Here.
I can see you, Maggie, thank you. Shona McFarlane. I can see Shona
Here.
as well.
Yeah, I'm present.
Sandra McLeod.
Present.
Paul Mitchell. Alison Murray. Graham Simpson. Did see Graham online as well. Yeah, thank you.
Morning, Emma.
And we have apologies from Mark Burrell, Hussein Patwa, Councillor Fairfield, Caroline Howarth, Phil Mackey, Adam Caldwell and Fraser Bell.
Thanks, Emma. Get a bit of feedback there, sorry. Yeah, welcome to. Just wondering what we can do about this feedback. Okay, let's try and soldier on, struggle through if we can. So welcome to Professor Batty to his first meeting online, and want to note that this is Sandra McLeod's last meeting, so I want to wish Sandra all the best for the future. Also, it's Alison Murray's last meeting, so also wish her all the best for the future. In terms of other things to say at the outset, just to note that we won a Bronze Digital Telecare Implementation Award back in the 11th of January. So that's good news and well done to the guys involved with that. And that's, I think, going to bring us to agenda item 2, which is declarations of interest or transparency statements. Do we have any? Not seeing any hands. Okay, that then will take us to the item 3.1, determination of exempt business. Can we agree to take items 8.1 and 8.2, which are the exempt appendices in respect of items 5.1, 5.2, and we have a fully exempt report at 8.3. Can we agree to take those in private? Agreed. Okay, thank you. then takes us to item 4.1, which is a video presentation about Charlie House. We picked this one because we've got the Carers Strategy Year 1 implementation on the agenda for today. And Charlie House looks after kids with life-threatening and life-limiting conditions, but also their carers, usually their parents, but also can also be their siblings. I've certainly been to their offices on Carden Place, which is just the side of Queen's Cross. I've been really impressed with what they've done there. So I will hand over to Ross to do the video, which we might have a wee hiatus because, again, part of the IT issues are making this not as smooth as it might be.
We have done amazing activities with Charlie House, and what is even more nice about it is that these are free to us as a family. There are some things that you can't just go out and try willy-nilly, and Grace might only like 5-10 minutes of it. Grace and Gibson and myself have all benefited from activities. We have done bowling, trampolining, ice skating, and this is all accessible. It's all suitable specifically for children like Grace and all the other kids that come to Charlie House. And we did pony access. We live in Newborough. I see the dunes from my bedroom, but we never get access to it. We can't take Grace there. There's nowhere for her to go. And you just think it's such a shame that I literally have it on my doorstep and we can't access it whatsoever. But Charlie House made a activities day, and it was pony access, which was on Newborough Beach. And Grace's buggy just goes onto the back of it. She gets strapped in, and this horse in this car took her right out, right along to the beach, up to where the seals are. And never in our days have we ever done that, because it isn't accessible for her at all. And Charlie House made that happen. They made it happen, and it was amazing. And Grace was just in her element. And Gibson loved it because he got to jump on the cart when he wanted to and jump off and run up and down the side of the beach. But these are things that you want as a parent. You want your child to be happy, and you want your child to experience these things. That would never happen had it not been for Charlie House, because it's all done for us. And that is amazing.
Guys, wait, important message. First of all, I'm Rory Reid and you're watching Auto Trader. Here's why you need to.
John, you're on mute. I don't know if you're supposed to be speaking.
apologies. We had a cunning plan to try and stop the feedback, but clearly it hasn't worked. So I'm sorry, there's going to be a bit of an echo in here. Yeah, sorry. So we were at the minutes of the meeting the 5th of December. I'll go back to the beginning of them actually, in case folk couldn't hear at the start. So are we okay with page 5? Page 6? Page 7? Page 8? Page 9? Page 10? Not seeing any hands. In which case, can we move to item 4.3, which is the draft minute of the Risk Audit and Performance Committee from 28th of November. For noting, I don't know whether Martin wants to draw our attention to anything in particular. Any questions? Nope. Okay. That takes us to 4.4, which is the draft minute of the Clinical and Care Governance Committee of the 31st of October. Again, this is for noting. Does anyone have any questions on this one? Nope, not seeing any hands. Okay. That takes us to 4.5, which is the business planner. And I'll hand over to Sandra for this one. Oh, sorry, Alison. Alison should hand over to somebody else. It's kind of like pass the parcel.
Hi, thanks. Sorry, I'll deal with the business planner. So reports on lines 5 to 11 are on today's agenda. Line 12, the GP vision report, we are seeking approval to bring this to the next meeting on the 26th of March. Lines 13 and 15 are both deferred to the May meeting for the reasons provided. And line 14, the audited accounts are now received, and again, the plan is to bring that to the March meeting. We're just looking at the timeline for preparation of the next strategic plan, and we'd look to bring a draft of this to the November meeting, seeking approval to put that out for public consultation and bringing the final version for approval to the March 2025 meeting. But other than that, it's all as it is.
Any questions for Alison? Nope, not seeing any hands. Just a brief comment from me on the GP vision stuff. I think it's really, really important that we get this right. So I'd rather defer it for a bit and get it right rather than bring it too soon to meet an arbitrary deadline. So I'm personally comfortable with that. Okay. Can we then move on to the next item, which is the insights and topic sessions, which is over to Alison again.
Yeah, sorry, back to me. Thank you. So we've got sessions planned in terms of the insights. We've got sessions planned for February and April. But just to note that the climate change item will not now come in February. We're going to replace that with a session on working with our partners, which kind of fits in with the other items that are on that session. The GP sustainability session, which was scheduled for April, will now be covered in a new March session, a joint session on the GP vision or the primary care vision. So we'll be looking for an alternative topic for that. And as I say, in terms of the topic specific seminars, that GP vision session has now been arranged for the 5th of March from 2 till 3. And that was the only date I think that we could get for the 3 IGBs. Our own
topic-specific seminar on finance is also scheduled for that same day. In the morning, though, it's 10 till 12. So just really checking with IGB members that that's okay for them to have two sessions on the one day. They don't clash, but it's just there will be those two sessions, or if you'd like us to look to reschedule the finance session.
Any comments or questions? Martin?
Do I need to switch on my microphone? Yeah, I'm very pleased about the proposal to have a workshop on working with our partners, and I just wondered who would those partners be, and will they be present at that event?
So we weren't planning on inviting partners along. It was just really to describe the relationships that we have with various partners, whether across Aberdeen City Council, third sector partners, commission providers, and the likes of Sport Aberdeen and people like that. So it was just really to describe that partnership working. And I think at the insight session, if there's anything that folks would like to know more about, we can perhaps arrange a session with the specific partner later on.
Great, thank you very much. There is the deferred item on the Northfield Hub that was in the business planner, and I think that that's an excellent example of working with partners. So that I imagine that it's that kind of relationship connection that we'll continue to explore in the Insights meeting. Thank you.
So I've just got a little bit to finish off on
sorry.
the sessions. Yes, so the dates for Insights and topic specific sessions have now been identified beyond April, and they'll be coming into your diary soon. In fact, I think the topic specific seminars are maybe already in diaries, and we're just waiting on confirmation for availability of rooms before we get the insight sessions into diaries. So can I just ask IGB members to consider any topics that they would wish to have covered in these sessions? I'm not necessarily asking for suggestions today, but if anybody could email me with any suggestions so that we can get these scheduled in. The topic specific seminars are normally for an in-depth discussion on a report coming to a future IGB, whereas the insight sessions are open for IGB members to gain greater knowledge and understanding of any area of the partnerships business. So any suggestions welcome.
Jennifer, you had a question?
Well, thank you, convener. Will there be a session, an insight session on climate change scheduled for the future?
Yes, absolutely. We'll get that rescheduled for later on in the year. The team that are working on the climate change work, I've just asked for a couple of months, perhaps, to get some more information together. So we haven't, because we haven't quite got the dates of the sessions in diaries yet, we haven't picked which one, but it will definitely be rescheduled.
Okay, any further questions for Alison? Not seeing any hands. At this point, we're going to take like a 2-minute or 5-minute break because we think we might have a solution to the IT feedback issue. Fingers crossed. We might not. But we think we should give it a go. Fingers crossed.
Fingers crossed. Fingers crossed. Fingers crossed. Fingers crossed.
Try that now, John.
I think it might work now. I have to turn my mic on, aren't I?
Teams. There's on the barrel. There's.
Your microphones.
Is it? Can you hear me?
You're going to go for everything.
My mic. Try that one. Can you hear that, Susie?
Yeah, Roz, when you have your mic open and then John speaks, I can hear John and you. So I don't know if you're near the main video mic, maybe that's why we can hear. I don't know if John can speak if you leave your mic open, Roz.
Okay, so is that working? Yep. Great. Hey, nearly there. I should say for those joining for the first time, things have worked smoothly for the past couple of meetings. We're using the same technology in theory today, so why it hasn't been working properly is anybody's guess. It's I'm not a techie guy, so I certainly wouldn't know. Right, so where does that take us to? Chief Officer's report, which I will hand over to Sandra.
Okay, thank you, John. So good morning, everyone, and I'm sure all colleagues will have had the opportunity to read the papers, but I'd like to highlight a few areas. The local updates within the paper reflect the wide range of public engagement and collaboration with the Mental Health and Wellbeing Festival, the Partnership Conference, the 12 Days of Safety campaign by the Public Health team, and the investment through the Health Improvement Fund. All of these are evidence of very strong community focus and working with people and in partnership. We congratulate the team at the Len Ironside Centre for maintaining grade 5s, which is a very good in a recent inspection by the Care Inspectorate, a reflection of the excellent team and positive approach to delivering a very positive service. Well done for the team. The work that is underway with colleagues across Scottish Ambulance Service, the Flow Navigation Centre in Acute, our third sector and private provider colleagues in continuing our work in the areas of digital technology, our whole system pathways of service delivery are all contributing to positive outcomes for the people of Aberdeen. Not least of all, we see this reflected in the impressive reduction of 45% in unmet needs across the past 12 months and a corresponding reduction to 4 weeks from the assessment, exceeding the national target of 6. This, coupled with our continued low delayed discharges, reflects the hard work of our collective approach in the city, emphasising the collaboration, the system approach that we continually strive for. At a regional level, I would like to commend everyone engaged in the GP Vision and work in an innovative, collaborative approach of which the IGB will hear more of, potentially in March, but definitely then. The work and engagement of hundreds of colleagues at some of these meetings across Grampian will hopefully bring a new approach and plan for sustainable GP services that meet the needs of the people of Grampian. And finally, I would like to take this opportunity as I present my last CEO report at my last City IGB to thank everyone I have worked with for the support, the commitment and the collaboration and the caring way they have approached our delivery of the strategic plan and delivery across the city. I'm very proud of the work that we have collectively achieved and feel very privileged to have undertaken my role so well supported by the senior leadership team, the IGB, and all the teams across the partnership and all essential partners across the whole system. Everyone always focusing on what we can do to improve outcomes. We are truly a caring partnership. Thank you.
Thank you, Sandra. Anyone have any comments or questions for Sandra? Martin?
Yes. Thank you. First of all, it's great to see the good result from the inspection at the Len Ironside Learning Disabilities Service. That was an unannounced visit, and it's really reassuring to see that result. The Health Improvement Fund update mentions 2 projects, and presumably there is a range. There will be a range of projects with some form of strategic connection between them. Might be useful for us to get an insight into that broader thinking and vision around the Health Improvement Fund. And these are, excellent projects, but health improvement and the work that the fund does makes a huge difference for the good. So maybe if we had a broader understanding of how the fund's working, that might help for the future. And the other one was about the social needs pathway. So this appears to be a kind of a triage system and I'm wondering what is intended to have an impact on ambulance waiting times. Is that what it's about? So some more information on that flow navigation centre, I think would be helpful. What's its purpose?
So I think I'll come back on the last point first, then hand over to Alison about the Health Improvement Fund. So the Flow Navigation Centre is a government initiative that most areas have, whereby all calls are triaged before someone comes in to make sure they're going to the right area. With our SAS colleagues, often when an ambulance is called or people are called in, they go directly to the front door, if you like, directly to ED. And in many cases, there isn't, so we have examples of people going in and then having to wait outside or even come into hospital, which then are not needed. So people can be waiting from care homes for maybe up to 12 hours once they're ready to go home because of transport. So this has really helped to determine that wide range of what is available within the community and for us making that connection. Ultimately, it should have an impact on, yes, ambulance turnaround times, but the biggest impact it should have is getting people looked after in the right place and in the right way and not putting them through unnecessary trauma, if you like, for them. Does that?
Good. Yeah, that's very comforting to hear, because I've had comments back about lengthy waits. So this is lengthy waits to get into the hospital, and sometimes it's emergencies or non-emergencies. So it's really good to see that some consideration has been given to direct and channel transport to meet the varying needs of patients. So that's very good to hear. Yeah, excellent.
In terms of the Health Improvement Fund, we have been putting regular updates into the Chief Officer's reports as a way of trying to update people on that. But absolutely be delighted to do a session perhaps at one of the insight sessions on just exactly what the Health Improvement Fund is, where it comes from, how we deal with applications, etc. So happy to schedule that in so that folks can get a bit more of an in-depth understanding of it.
Thank you very much. It's always good to read about the individual projects, but they are quite scattered, but I think that collectively they contribute quite significantly to the prevention agenda.
Absolutely.
And that's where I think there needs to be a focus. So I think the Health Improvement Fund has got a lot to offer for the varying care needs of individuals and communities. Thank you.
Thanks, Martin. Did I see a hand from Chris Smiley?
I think possibly I stole Chris's thunder, but he might want to come in.
Yeah, I think that's a good suggestion, Alison. It was kind of something I was thinking of as well. But just to kind of give a quick summary of we link the Health Improvement Fund back to the strategic priorities of the partnership. Also links the locality plan and the local improvement plan, so it's always connecting into that. And again, we've been doing some work around about consultation with community members through the LOIP refresh as well as that. And even within the last round, we've adapted the community consultation feedback into the priorities of that, and we're able to kind of map those projects back to the strategic plan and the locality plans as well. So, but again, happy to go deeper into the projects that are kind of inside there.
Thanks, Chris. Any further comments, questions? Can't see any more hands. Are we therefore happy to approve the report? Oh, sorry, June Brown.
Sorry, just at the last moment there, John. Sandra, thank you for your paper and your report. My question's in relation again to the FNC work, that social needs pathway, which looks excellent and stops people who don't need to be at hospital, you know, not coming into hospital. Has that work been extended out to care homes? Because I could probably see a need in that environment as well. I suppose is my first question.
So I've switched my mic on there. Yeah, the FNC currently has a project that's working with the care homes. That's been running for some time. It was tested in Aberdeen City, and my last update, I'm fairly sure that's starting to roll out right across Grampian now. That's had considerable success in giving professional to professional support for care homes being able to go directly into FNC, and has shown a positive reduction in there. I think the point here of the single this service is really to look at how we can make that wider connection, not just with care homes, but for all the other supports within there.
Thank you. And John, can I just say an enormous thanks to Sandra for all the work that she's put in over the years, not just within the Health and Social Care Partnership, but also in NHS Grampian with the MUST portfolio, and the joining up of pieces like work like this wouldn't have happened if Sandra wasn't around leading it. So an enormous thank you.
Thanks, June. Yeah, I think Tayside's gain is going to be Aberdeen's loss, but we'll muddle through. Anything further on this one? Happy to approve? Yep, great, thank you. That then takes us to item 5.1, which is the complex care issue. We've got Jenny Ray, we've also got Paul Mitchell, who can answer some of the numbers questions, and we've also got Kay Dyack, who can talk us through the exempt appendix. In terms of the exempt appendix, if folk have got any questions on that, we'll need just to go into private session for that bit, but we can have a look at that before we move to recommendations. Martin.
Yes, I do have a question from in the exempt paper, which I'd quite like to explore before we deal with 5.1.
Okay, in which case can we pause the recording and then take us to and